What is the difference between LEEP and cryotherapy? Imagine facing a diagnosis of precancerous changes in your cervix. You might wonder what options are available to treat these early signs of potential trouble. Two common treatments are LEEP and cryotherapy, but they work quite differently. LEEP, or loop electrosurgical excision procedure, involves using a thin wire loop heated by electric current to cut away abnormal tissue from the cervix. This method removes the lesion along with some healthy tissue around it, which helps ensure all abnormal cells are gone. Because tissue is removed, it can be sent to a lab for analysis, allowing doctors to confirm the diagnosis, see how severe the lesion is, and check if all the abnormal tissue was successfully removed. Cryotherapy, on the other hand, is a technique that destroys abnormal tissue by freezing it. A probe cooled with refrigerant gases is applied directly to the lesion, causing the cells to die through a process called necrosis. And like LEEP, cryotherapy does not remove tissue, it simply destroys it. This means no tissue is available for lab testing afterward, so doctors cannot examine the lesion directly or confirm the diagnosis through pathology. When it comes to effectiveness, studies show that LEEP tends to have a lower chance of the abnormal cells coming back or persisting after treatment. It is also better at clearing high-risk human papillomavirus infections, which are linked to cervical cancer. LEEP is suitable for treating lesions that extend into the endocervical canal, the inner part of the cervix, making it more versatile. Cryotherapy works well for small, fully visible lesions on the outer part of the cervix, called the ectocervix, especially in settings where resources are limited. Both procedures are generally safe, but they do carry some risks. LEEP involves cutting and may lead to slightly more bleeding or narrowing of the cervix, which can affect future pregnancies but is usually manageable. Cryotherapy is simple and does not requiring electricity, making it a practical choice in many low-resource environments. It may have a slightly higher chance of the lesion coming back if the abnormal tissue extends into the canal or is larger. Choosing between LEEP and cryotherapy depends on several factors. If the lesion is large, involves the endocervical canal, or if a tissue sample is needed for diagnosis, LEEP is often preferred. For smaller, fully visible lesions on the outer cervix, especially where equipment or expertise for LEEP is unavailable, cryotherapy can be an effective and straightforward option. In summary, LEEP is a procedure that removes abnormal tissue and provides valuable diagnostic information, with generally better outcomes for preventing recurrence and clearing infections. Cryotherapy destroys abnormal tissue by freezing it, making it suitable for specific lesion types and resource-limited settings. Both play important roles in preventing cervical cancer by treating precancerous changes, and the best choice depends on the individual's specific situation, lesion characteristics, and healthcare setting. Always consult with a healthcare professional to determine the most appropriate treatment for your needs.